Hello, I'm Dr. Chris Steele and welcome to one of my medical moments. At this point in time I'm going to just talk about depression, only for a minute or two. And depression, people say, oh yes, I get depressed. Well, a lot of us feel down, feel low, but that's not true clinical depression. I can tell you this because I've had full-blown clinical depression several times, and I actually now take an antidepressant tablet every day for the rest of my life, and that doesn't bother me. Now, a lot of people get upset about being labelled as a depressive or having to take medication. Let me just simply explain depression. Basically, your brain is drained of the chemicals that keep you in a sort of a level mood, and one of those chemicals is called serotonin, and when you drain your brain of serotonin, then depression can creep upon you. And the antidepressants that we use now boost the levels of serotonin in your brain and put you back to normal. It's not unlike hormone replacement therapy. Your body's running short of hormones, so you take hormone replacement therapy to boost those levels. So think of depression as a condition where you're replacing substances that your brain has actually become very low in, and that makes it easier to accept. You may be thinking that you're inadequate, you can't cope. People say pull yourself together. If you could pull yourself together, you would do. And one thing I label depression as is the loss syndrome. Loss of interest in everything around you. Loss of interest in your family, your friends, your job, loss of interest in music, loss of interest in humour, loss of interest in sex. It's loss of interest in everything. I know when I first got depression, I didn't find anything funny. I didn't like reading newspapers because of the bad news. I lost all interest in music. So, if you have these symptoms, and another symptom of depression can be early morning awakening. Wakening about 4, half 4, 5 o'clock in the morning, wide awake, you can't get back to sleep, the place is quiet, you're mulling over how bad you feel, it's all doom and gloom, and it's a very difficult symptom to control. So antidepressants will put you right, and when you take antidepressants, they may take a couple of weeks before they start kicking in, and then they improve you just gradually. And one of the early improvements from antidepressant therapy is an improvement in your sleep. That early morning awakening gets less and less. And you may not notice that you are feeling better, but your close family or close friends will notice an improvement in you. So if you're given medication, take it, allow 2 weeks for it to start working, and take it for as long as advised. The odds are you'll be advised to take it for about 6 months, maybe longer. If you've had depression a few times, your doctor may advise you that you should be on an antidepressant for life, as I am. So don't worry, take the tablets, they'll get you right back to normal. Thanks for watching.